Hello and welcome to the Patient Educators Update. My name is Chuck Jones and I'm joined today by Fran London, our resident expert on all things associated with patient education and patient education topics in a clinical environment. Hi, Fran.
Hi, Chuck.
It's good to talk to you today. We are going to continue our discussion about self-efficacy. We started this several episodes ago, and we briefly touched on self-efficacy, and then we talked about ways to improve that in patients by discussing skills mastery and modeling. Now, in today's episode, we are going to discuss something called reinterpretation of physiological signs. That just rolls right off the tongue. Can you please help us understand what that is? What do we mean by reinterpretation of physiological signs?
Okay. Well, we're talking about this in the context of self-efficacy, which is whether a person can believe they can do something. Mm-hmm. And if they can't believe they can do it, they're not going to be able to. Sometimes people have symptoms or feelings they misinterpret. So if you feel something in your body and you're interpreting it incorrectly, it might lead you to feel that you can't do a certain behavior change. For example, someone with a chronic illness may also have some depression, mm-hmm. and they might interpret that depression as their illness is getting worse. They don't feel good. They don't feel like doing stuff. So they think they're sicker and they're less motivated to make a change in their behavior.
Sure, that makes sense.
Whereas if they, if you then intervene, if you find out that's what the issue is, you can ask them about how they interpret these feelings, and then you can help them understand that the depression is something separate from the illness, in that if they were just be able to maybe mild exercise with a little bit of walking or something, that might help relieve the depression and might help them feel better with the chronic illness. Yeah. So it's more helping them understand what's going on with their bodies.
Okay, so basically what you're saying is what they think is happening may not be what's happening, and it's incumbent upon the patient educator to be able to kind of drill down into what the patient is feeling, what they're sensing, what they think it is, to find out if that's really the cause. Because in your example, if it's fatigue, if they're tired all the time, they think it's the disease, and it may not be. It may be the depression and why they feel kind of, blue and, poor little old me. And I'm not trying to reduce that feeling because I know it's a tough thing that they're facing. But, there's two ways you can go after the problem. You can let it roll over you, or you can fight back and say, wait a minute, I've still got a long way to go.
Exactly.
Yeah.
Exactly.
Okay.
Yeah. So this is not always the issue with self-efficacy,
mm-hmm.
but if it is, it's something you need to address.
Okay. All right. Well, that makes sense. Okay. So reinterpretation of physiological signs, basically it's helping the patient understand that what they're feeling may or may not be what they're really feeling. Right?
Exactly.
Okay, cool. All right. Well, thanks for your input on that today. We're going to keep it short. Why don't you tell folks where they can find you online?
I have a website, a blog at www.notimetoteach.com. And I'm also on Twitter at NoTimeToTeach.
Okay. And I want to point out, I didn't mention it in the beginning, but the basis for our show is your book, No Time to Teach, which is the primer for where we take our topics each week. And this book, in addition to being available at Amazon and all other booksellers, is also available for bulk purchase at a sizable discount from your publisher, Pritchett and Hull, and their website is p-h.com. And for directors of nursing, patient educators that are looking for a great resource to use in their teaching, you can get a sizable discount by contacting the publisher directly. And for anybody out there on the patient education side that's interested in using video as part of their patient education, you can visit our website at synergybroadcast.com and look for our patient education system called MMDS, or Medical Media Delivery System. It's a video on demand system for hospitals. So with that, Fran, I thank you for your time today, and we'll talk to you next time.
Yes, thank you, Chuck.
Okay, bye-bye.
Bye.